Hello and welcome to the Dr. Skeletal Medical channel. Here we discuss about various medical issues. Now the topic for today's discussion is macrocytic anemia. Now what does anemia means? Anemia means overall decrease in healthy red blood cell or decrease in hemoglobin concentration in our circulation below threshold. We have standard values. For adult male, it's less than 13 gram per dl. For an adult female, it's less than 12 gram per dl. And for a pregnant female, it's less than 11 gram per dl. Now, before going any further, we have to discuss about few terminologies like MCV, mean corpuscular volume. Now, it refers to the average size of the red blood cell. Okay. Now, we have the standard value of 80 to 96. MCHC, mean corpuscular hemoglobin concentration. It refers to the average concentration of hemoglobin in the RBC. The standard value being 33.4 to 35.5 gram per dl. Now let's see anemia. Let's divide anemia on the basis of size. We can divide further into microcytic, normocytic, and macrocytic. Microcytic. What does micro means? Micro means small. Any red blood cell is smaller than 80 femtoliter is called microcytic. Normocytic ranging from 80 to 100 femtoliter. Whereas macrocytic, bigger one, is bigger than 100 femtoliter. It is also the topic of today's discussion. What does macrocytic anemia means? What does macrocytic means? Macro means big, cytic means cell. This is a big cell anemia. Now, obviously, they are bigger than normal red blood cell. We can further divide macrocytic anemia into two divisions: megaloblastic and non-megaloblastic. Now, what does blastic means? Blastic means immature. These RBCs are released in a circulation before hitting proper maturity. Now, let's further discuss megaloblastic anemia. See this normal neutrophil. To be a normal neutrophil, one neutrophil must have 3 to 4 lobes. But in the second slide, we see hypersegmented neutrophils with 5 or more than 5 lobes. Now, hypersegmented neutrophils is also a significant characteristic of megaloblastic anemia. Whenever we are talking about megaloblastic anemia, one thing we should be clear is it has some issue with DNA synthesis. See, normal blood forming process, erythropoiesis, going down from pro-erythroblast to erythrocytes, the size of the cell gradually decreases as it loses a lot of cell organelles like nucleus, like mitochondria, like ribosome. But in the case of megaloblastic anemia, the size of the cell doesn't decrease, rather it increases. Why does it increase? Because cytoplasm keeps on growing bigger as RNA and protein synthesis continues. The only problem lies with the DNA synthesis. Now, what are the causes of megaloblastic anemia? Now, there are two major causes of megaloblastic anemia, one being folate deficient, other being vitamin B12 deficiency. Now, we can check what is deficient, and if both folate and vitamin B12 are low or in the lower bottom of an average, then to determine the specific cause, we can check for methylmalonic acid. Now, if the methylmalonic acid level is increased, then we have to conclude that there is problem with vitamin B12 deficiency. But if methylmalonic acid level is normal, then the problem lies with folate deficiency. Now we can see the non-megaloblastic anemia. The size of the RBC is still big, but there is no issue with DNA synthesis. Neither it has any problem with neutrophil. We still have 3 to 4 lobuled neutrophil, no hypersegmentation like that of megaloblastic anemia. Now, what are the causes of non-megaloblastic anemia? There are a variety of causes of non-megaloblastic anemia. Few are listed here. First, alcoholism. Second, liver disease. In a lot of liver issue, we can have the non-megaloblastic anemia, like endocrine, hypothyroidism, genetics like Down syndrome, reticulocytosis, even on pregnancy, and some various drugs. Now, let's discuss the main agenda, phagocytosis. Whenever there is macrocytic RBC, there is no problem as long as it's inside the bone marrow. Once it gets released in the normal circulation, the problem starts, as macrophages cannot recognize this macrocytic RBC, so it tries to destroy it, phagocytes. During this process, the macrophage not just destroys the macrocytic red blood cell, rather it destroys almost every single blood component. We have the specific term for this, that is pancytopenia. What does pancytopenia means? Pan means expanded, cyto means cell, penia means deficiency. Why does pancytopenia occurs? As I have already discussed, because the macrophages destroys almost every single blood component. So with megaloblastic anemia and non-megaloblastic anemia, overall in macrocytic anemia, we have two problems. One, the size has increased, the other, pancytopenia. Now, do you know what is more important than red RBC? The red subscribe button. Better hit it. Do like, share and subscribe to our YouTube channel. Help us to gain 100 subscribers. Thank you.